Hi, this is Dr. Tina Rokadia, and today I want to talk to you about snoring in children. Where could this come from? 3 common known causes are a blocked nose, enlarged adenoids, or overgrown tonsils. All of these are aspects that your ENT can check out. But what happens if the ENT says that the airway is clear? Or worse, if your child has already had their tonsils and adenoids out and is still snoring? Very often, this comes from low tongue posture. The low tongue posture could be created because of a blocked nose, but it could also come from tongue ties or due to habit or low muscle tone. It is very important to get this corrected as soon as possible.